Hello everyone, I'm Aikari. I'm a multimedia reporter for Rappler. Welcome to MovePH Webinar on coronavirus and its impact on Philippine employment and overseas Filipino workers. So joining us today are Cher Verick, Senior Employment Specialist at the International Labor Organization in Geneva, Attorney Sonny Matula, Chairperson of Nagkaisa Labor Coalition, and Annie Heron, the Vice President of Public Services International. Hello, everyone.
Hello, Aika.
Okay. We also have Ms. Melay Abao. She's the Assistant Professor from the Political Science Department of Ateneo de Manila University. She will be our moderator for today. So, Ms. Ms. Melay. Hello.
Yes, hello, Aika. I'm here.
Okay, I'll ask Ms. Melay to moderate the discussion. So far we have the three speakers who will give us some briefers on the impact of coronavirus here in the Philippines and abroad. So can I ask Ms. Melay to take over the discussion, please?
Okay, thank you, Aika. I think the speakers beforehand have already been briefed on how the format will go. Basically, we will follow the format of yesterday's webinar on the impact of overseas employment. So we will focus on three main topics. One is your assessment of impact. Two, the interventions so far and what you think of these interventions. And three, the ways forward. So for the impact, we hope to discuss what's the impact, well, firstly on the health of workers, because this is primarily a health crisis. And then, of course, what is the impact on jobs, on wages? Okay. And I would just like to remind the speakers that as much as possible, let's go through all types of workers and discuss, which types of workers will be hardest hit, which types of workers will be least vulnerable, and perhaps there's even talk of there might even be increased demand for certain types of workers after this. There might be differences also across genders. It might be different for men, male workers. It might be different for female workers. It's probably also going to be different in Manila and in the Visayas and Mindanao or in Luzon. So we hope to cover all that. And of course, with our ILO speaker, it would be good to see maybe even the bigger picture. For the interventions, definitely we will talk about the 5 billion social amelioration program of government and the law. I can never remember the name. It's a
Bayanihan.
Healing whatever law. Okay, so
Heal as one.
Heal as one law. And then, of course, aside from the government effort, it would be good to know what the unions are doing. And also what the ILO is doing. For the third part, the ways forward, is really the medium and long-term view. So what do we hope how will work look like in what they always say is going to be the new normal? So, and how should we prepare workers and unions for this new normal? But before anything else, I forgot to say Happy Labor Day.
Happy Labor Day.
Tomorrow. So our forum is really also our way of celebrating the International Labor Day. So I suggest we start with Mr. Sonny Matula of Nagkaisa for the private sector. And then we go to Annie Heron for the public sector. And then to Mr. Verick for the even bigger picture. Is that okay? Yes. Okay. So, Sunny, shall we start with you, please?
Yes. Good afternoon. Okay.
Yeah.
So, happy Labor Day. The day after tomorrow is International Labor Day, the 134th anniversary of the Haymarket affair, where the workers pursue the 8-hour workday. We are now in the midst of a pandemic, and I believe that the future belongs to those who prepare for tomorrow. And what we are doing today is a preparation for tomorrow while defending our workers or the Filipino people from the coronavirus. The first thing that I remember is the impact of this pandemic to the workers. Of course, the health of the workers. All workers are vulnerable to this coronavirus 19, and the hospitals are in my mind. And the first thing that was reported to us is the long hour of work in the hospital, although nobody among our members was reported as infected. But the long hours in the hospital was the first thing that was reported to us by our frontliners who are our members in UERM, in De La Salle, in Capiz Emmanuel, in the Visayas, and the Iloilo Mission Hospital, and in San Pedro Hospital. There are almost 29 or 21 million workers who are affected as all over the country. But those displaced, the affected most is the tourism industry, about 600,000, and the trade workers, those in the buy and sale, about 400,000, I think. And the first thing that happened in the lockdown, of course, we are surprised to receive the notice that there was no work on the 15th of March. And of course, we are not prepared for that. And the workers are worried. But there was a meeting before that with the Department of Labor and Employment that the workers will be given some sort of subsidy or salary for about 10,000 pesos. But after that, the actual pronouncement of the government is about 5,000 pesos. But we are sad with the 5 billion appropriation given by government, because that is only about 1.4% of the gross national product of the Philippines. We have about 355 billion gross domestic product, but we only provided about 250 billion pesos for the initial confrontation with this pandemic. So that is only about 1.4% of our GDP. And some of our union leaders are telling us that it appears that we are confronting a 10 feet high surge of water, 10 talampakang rumaragasang tubig, at nagtatayo tayo ng isang dangkal na dike. So masyado atang malayo yung ating ina-attempt na salubungin, ano? Isang talampakan, isang dangkal sa 10 feet surge ng tubig. So parang kulang. At kulang talaga ang nangyari, kukunti lamang. Sabi ng Presidente nung isang linggo ay 49% lamang ng mga manggagawa ang nakatanggap ng ayuda mula sa gobyerno. So higit na majority ang hindi nakatanggap. Sa amin sa FFW halimbawa, sa Federation of Free Workers, isang miyembro ng kaisa, 100 namin na union sa Luzon, mga 80 dito sa Metro Manila, ay 2 union lang namin ang nakatanggap, yung FOC Transport at saka yung RGG Transport na nasa labas ng Metro Manila. Yung sa loob ng Metro Manila ay walang nakatanggap na mga unionista na galing sa FFW doon sa tinatawag na camp. So, diyan lang muna siguro ako, pansamantala.
A quick question, Sunny. Would you know the reasons why hindi sila nakatanggap?
Unang-una ay siguro dahil inuna yung mga maliliit na kumpanya. At yung mga malalaki-laki ay hindi binigyan. O akala siguro nila na lahat ng mga malalaking kumpanya ay may mga binibigay yung kanilang mga employee para masustentuhan. At isa rin dito ay dahil siguro mas marami o hindi handa yung Department of Labor na tumanggap ng maraming mga application. So, yun ang mga problema.
All right, thank you. Can we go to Annie first?
Okay, thank you very much. And
Thank you, Sunny.
also greetings from the Public Services International on the occasion ng Labor Day. So I'd like to start my assessment with the point of departure of the pre-COVID. No? Before COVID-19 pandemic, the public sector and public services, particularly health and social care, were already weak and inequitable due to inadequate funding and the long-term effect of privatization of the services. So when COVID pandemic hit us, it really hit us hard, overwhelming the already weak healthcare services, and consequently impacted on the ability of health workers to do their jobs safely, effectively, and efficiently. No? COVID really cost the lives of many health workers. The latest statistics is the infected health workers account for between 36 to 40% of all the number of cases, infected cases of COVID. So the pandemic exposed the enormous gaps and outright absence of necessary facilities, equipment, tools, and as basic as personal protective equipment. Unemployment, while at least 2 million tenured civil servants are able to keep their job and continue to be paid during the entire expanded community quarantine, this is not the case or may not be the case on the part of contract of service and job order workers and other workers in precarious work arrangement. No? For local government, for example, who now struggle for funds to assist, to provide assistance in kind or through the social amelioration program, they're likely to let go of these contractual workers because they have to use the maintenance and operating expenses where these contractual workers draw their salary and to augment the limited or the inadequate subsidy from the national government. And Melay, we're talking here of no less than 350,000 job orders and contract of service. No? So these are likely the one who will really be laid off. No? So yung COVID pandemic makes the task of the health workers and frontliners very difficult, hazardous, and vulnerable to violence, harassment, discrimination, and isolation. And the news almost daily would really provide concrete examples on how they are experiencing that. No? But on the positive note, COVID pandemic also make the government look at the health workers in a different way. I think we can feel how they recognize and value more the work that they do. No? On the current intervention, on the second big question, on efforts of the government, yes, we see a lot of efforts, TUPAD, YAKAP, SAP, etc. But I think they're better coordinated. They're better coordinated. Once they are also targeted, even if the result of the COVID-19 is universal. No? So there are really those who are left out. On the part of the public sector, unions under Public Services International, we maximize the available platform. No? For example, we managed to make the Civil Service Commission issued a memorandum circular providing guidelines on the provision of COVID quarantine leave, paid. No? And this include the payment of job orders and contract of service. And then we also succeeded in pushing for the granting of hazard pay of 500 per day. It may not be sufficient, but we came from a zero hazard pay for healthcare workers during ECQ. We somehow draw attention to prevent the recruitment and the employment of healthcare workers in the middle of this crisis on a volunteer basis and give them a monthly allowance. No, that is not commensurate to the dangers and hazards that they are facing because of this crisis. So we also managed to include finally the barangay health workers as recipient of SAP because before they were excluded. Recently, the PSI affiliates agreed that we will launch an online survey to gather information on whether healthcare workers and frontline workers are actually receiving the hazard pay, free board and lodging, the PPEs and transportation that the government under this Bayanihan Feel as One app said that they will provide. No? How many lost their jobs? How many healthcare workers infected with COVID? How many unfortunately died and how many recovered? No? So in other words, we would like to really monitor this new terms and condition of employment that that is now being provided for our health workers. No, we also prepare a common template because, as you mentioned, Melay, it's going to be a new normal, and therefore, before the government employees, public sector workers go back to work, I think we need to have a template on workplace guidelines and protocol. No? What do we do? It cannot be dating gawi yung dating normal, no? Kasi we have seen how COVID-19 changed all of that, no? And last of the three big questions on the ways forward, no? I think we would like to call upon the government to build up the capacity of public health care. No? First and foremost, provide adequate funding so that you can enhance the facilities, you can procure tools and equipment, you can have enough PPEs. No? And then ang nakalimutan talaga, what is really neglected for the longest time, is the support for research. 50 million, 100 million, it won't solve the problem if you are just giving the support now. It should have been many years ago, no? That will prepare our researchers, our biologists, our practitioners to prepare us in this kind of infectious diseases. For example, I think it's not only RITM, but more Center for Disease Control should be supported. We would like the immediate hiring of more full-time health workers. At the moment, we have around 150,311 healthcare workers, different categories or profession of the health workforce. And we need, at the moment, just to respond to the pandemic, we need 15,000 healthcare workers immediately to be hired, okay? So we also want to call for the suspension of personal services cap. This is the limitation for local government, so that if this cap is suspended, they can hire the needed healthcare workers with subsidies, of course, from national government. We would like, on the long term, to make the internal revenue allotment formula to be more equitable, and we can do that by amending the local government code provision pertaining to ERA. No? We would like the government to recognize the workers, barangay health workers, and they are 45,042 barangay health workers in the Philippines who are working as volunteers. 98% of these Mamelay are women. So there is a gender aspect in this unpaid work, no? And this is about the only workforce in the government now who bring health services right into the household. Hindi katulad ng ibang health workers, nandun sila sa workstation, but these barangay health workers are really deployed in communities and in the household level. For the government, no, sana the government will not miss the big lesson of COVID-19 pandemic. And it is time for government to reclaim public services and bring them back in public hands. And it should put people over profit. Sabi nga namin sa nagkaisa, sapat na ayuda para sa lahat at yung call namin talaga ay yung para sa manggagawa, yung protektado at ligtas na balik trabaho. So I think that will be all that I have to say on those three big questions. Thank you very much.
Thank you, Annie. Maybe just two quick questions.
Yeah.
First on, you mentioned there are like almost 350,000 contractual workers.
Yes.
And of course, there's also a lot of barangay health workers
yes.
who don't have job security and who are not paid enough, etc. So what
yes.
exactly is the proposal of your union? Do you want these contracts to be extended? Do you want them regularized? Or what?
Yeah.
Okay, so that point first. And then the second point is on the health workers, on the need for health workers here. Obviously, it was an issue of whether we would ban the out-migration of health workers, no? What is your position on that? Obviously, the policy was already rescinded, but it would be good to discuss that as well in terms of taking off from what you said about us, the public health sector here, really needing also health workers.
Yes, we would like first the barangay health workers, and there are, 42,000 of them, to be recognized as worker and to be compensated well, no? They should be regarded as workers because they're actually delivering health services. We want the hiring to be not contractual, not on emergency, but full-time and regular. Give them because if you are saying that health workers are heroes now, and then you are just prepared to give them contractual employment for 3 months, I think it doesn't. The government is not putting money where its mouth is, and it's not walking the talk. You don't value health workers and regard them as heroes, and then give them 3 months contractual employment as if the COVID will go away and you have nothing else to do after 3 months, no? Which is not the case kasi may mga long-term steps pa tayo in order to prevent yung occurrence of this pandemic. Now, we know that the competition, that the factors why healthcare workers are migrating is more economic, no? I mean, it's very natural for people who cannot find gainful employment and decent work here to look for other places to work. So, and the best way for you to retain this valuable health workforce is to provide them decent employment, no? Provide them decent employment if you want to keep them, because that's the very reason why they're leaving. So, ang position namin dyan sa public sector is, banning, although they have rescinded that. Now, we will never support that. We are one with Nagkaisa when we raise the issue. Why ban them? Do you have any job? Do you want to ban them and then deploy them as volunteers or contractual workers here? So I don't think it is fair and it is just for our health workers. And please do not make them feel guilty for
Relieving.
for leaving. Don't
Yeah.
make them guilty. I think it is the government who should be guilty. Because
Okay.
I have seen many healthcare workers when we surveyed them and saying, if we can earn na break even lang, kahit wala pang masyadong saving, break even level lang, we will stay. Because it's so
Alright.
difficult to be working away from your family. No?
Yeah.
So yun po yung
Alright.
position namin.
Okay. Thank you very much, Annie. So I think now we should go to Mr. Verick of ILO. Sir, please.
Yes, good afternoon, and thank you very much for having me on the show. So let me start with the global scenario. At the ILO, we have been, of course, working very closely on the COVID-19 crisis, which has, as you've all recognized and said in the case of the Philippines, gone from a health crisis, which remains, of course, the priority, but has evolved into an economic and labor market crisis as well. Now, if you look at the global scenario, I mean, it's of course, I should stress, difficult to give precise numbers on the impact around the world, but the ILO has been working to come up with estimates that give an indication of what is the impact. And firstly, I would say all indications are that this is the worst economic crisis we've seen since the Second World War, and is going to be worse than the global financial crisis in 2008-9. And I'll give you one estimate that gives you an indication of that. Using a new model here at the ILO, we have looked at the likely decline in working hours as a proxy for the impact on the labor market in the second quarter of this year. And the figure that we have come up with and released on the 29th of April says that this decline is over 10% in the quarter, and that represents 305 million full-time workers. So this is a way of giving an indication of the impact. We also are looking at the sectors that have been most impacted, and you have and the speakers before me have already highlighted some of those sectors. But what we see globally, the most hard-hit sectors include accommodation, food services, the retail trade, manufacturing, and some other business areas. Now, tourism is clearly across those different sectors and is suffering greatly, as already been mentioned. And our estimate of the workers affected in those hardest hit sectors, released on the 7th of April, suggests that over 1.2 billion workers are being affected in these really most hard hit sectors. And that's a massive number. So we're really talking about millions of workers around the world in accommodation and food services, in retail, that are really suffering. And of course, many of these workers are unprotected, low-paid workers. And so they are also very vulnerable to the situation because of their own personal circumstances. So I think, we're pretty clear that, despite the lack of data that we have to give a very precise indication of the impact, all indications are telling us that it is extremely severe, and particularly in a number of sectors. And I think, as also mentioned, there are some important dimensions in terms of the effects on workers. Gender is one, as pointed out, and we know, around 70% of workers in the health sector are women, and they are most vulnerable to the direct effects of the pandemic in terms of the health aspects, but also in terms of the other sectors that are being very hard hit, including accommodation and food services, where women are also highly represented. Similarly for young people are often in very precarious jobs in these sectors. Another group that is also very vulnerable are the migrant workers, as of course extremely relevant for the Philippines. Now, this is just maybe a few insights on the global impact. Of course, it's varying from country to country, and you of course are in a better position to talk about the impact in the Philippines. But the problem this time is, compared to the global financial crisis, is that nearly all countries are being affected by the containment measures and the lockdowns of workplaces, etc. But even on top of that, we have then secondary effects through trade. So global supply chains are being disrupted. And then we have, of course, disruptions to migration itself, as you guys has been pointed out. So we have both the direct effects of the containment measures and the secondary effects through disruptions to trade, to migration, to capital flows, etc. So we're in a very difficult position because there are no other countries not able to escape the effects of both the direct effects of the pandemic, but also in particular the economic and labor market effects that are percolating through the world. So if you allow me, maybe let me say something about what needs to be done and what are the current efforts. And I think countries around the world are making great effort, and the speakers before me have highlighted a number of the steps taken in the Philippines. At the ILO, we have been calling for action across 4 pillars. Firstly, to protect workers in the workplace, as been noted. Really, the risks for workers in terms of the pandemic is absolutely critical and remains critical. But when we look at the economics and the labor market aspect, we have to look at all measures possible to stop the economies and labor markets from collapsing. So these are the stimulus packages, also has been referred to, particularly in the fiscal packages, but in some countries, the monetary policy. But then going down to the enterprise and worker level, what has been absolutely critical is to get funds to the businesses and workers. Again, in contrast to the global financial crisis, we have many well-run businesses and workers being impacted who were not vulnerable to or who were doing very well before the crisis. And we really want as many businesses and many workers to be there when we emerge from this pandemic. So it's absolutely critical to get funds to businesses and workers through different means. There are financial transfers to enterprises, tax relief, but what is absolutely critical is small business. And we know in a number of countries, small business is not getting enough support and sometimes are missing out from the available measures. Similarly for workers, workers who are in protected positions, as already been noted in the before by speakers, will have certain ability to continue. They remain employed, but it's the precarious workers, those without permanent contracts, are very vulnerable, and or if it's needed to ensure that they remain employed, but also looking at other types of transfers and social protection to help those workers and their families. Mm-hmm. And finally, I think the fourth pillar that the ILO has been stressing, and I think is very evident in the case of the Philippines, is the importance of social dialogue. We really need to see the solutions coming out of constructive dialogue between the government, the employers, and the workers. We saw that during the global financial crisis. It was absolutely essential to have the parties, the tripartite parties, come together to come up with constructive and effective solutions. And I think it's also important on these efforts to stress that yes, many measures are being announced around the world, but it is also vital that these measures are immediate and of a size that's going to address the massive decline in economic activity. So yes, it is very important to have a package from the fiscal side, but also to the transfers that are sufficient to cover those gaps, and they need to be rolled out as fast as possible. The time is now to ensure that we keep businesses and workers going. And globally, we need coordination on this. We saw that during the global financial crisis. The G20 played a very important role. And we need that coordination again as well to ensure that the world is addressing these issues in a coordinated fashion, and then going to be addressing the recovery in a way that's going to be supportive of the world. And there we also have to stress for low and middle income countries the importance of getting finance to these countries, looking at debt relief, etc., that has been also discussed globally and amongst the multilateral agencies. in order to ensure that countries which don't have the fiscal space, they don't have the resources, will actually get support to implement their measures.
Yeah. Thank you very much, sir. Well, very quick questions. Just, you mentioned that 1.2 billion are projected to be affected by this. When you say affected, does this mean in terms of job loss? Because we know some workers don't lose jobs, but they just have reduced pay. No? That's my first question. The second question is, I agree it's the worst economic crisis, the global crisis, also because of the level of uncertainty. So when you're talking about international organizations like ILO, for example, what do you see is the end of this uncertainty? And do you have some ideas of when that end uh, will happen?
Yeah, great. I think, yeah, the first question is very important. So I mentioned that over 1.2 billion workers are in the hardest hit sectors, it's accommodation and food services, the retail trade, manufacturing, etc. And that was an estimate the ILO released back on the 7th of April. Now, that is just looking at the numbers of workers in those hardest hit sectors based on data that we have on economic decline at the sectoral level. We don't yet have good data on job loss. So in some countries, some data has come out in recent weeks. For example, you may have seen headlines for the US. We know in the US, 26 million people have applied for unemployment claims since the pandemic, the crisis had started. But in most cases, in most countries, we don't know yet the numbers of job losses. So even the bigger figure I gave you first, that we estimate that working hours has declined by 10.5% in the second quarter, which is equivalent of 305 million full-time workers. We'll have to wait to see what actually happens to those workers. Some will, yes, remain employed, and particularly those protected ones. Others will lose their jobs, and millions will lose their jobs. But we will need better data over the coming weeks and months to give us a precise figure on job loss. But all indications are that job loss is happening in a number of sectors, and it also depends on the nature of the labor market policies and institutions. So the US, you see it far more rapid than other countries. Europe, they try to hold on to their workers as much as possible, so they put them on subsidized schemes, etc. So that's maybe on the job loss story. On the uncertainty and what's going to happen in the future. Well, obviously there still is an incredible amount of uncertainty about the pandemic itself. Many countries are looking at relaxing the containment measures, and announcements are being made every day now about, well, trying to move back. And as the speakers have said before, it'll be the new normal. Now, we don't have precise, of course, timeline on how this is going to happen around the world. There's still a lot of uncertainty whether a second wave of the pandemic will hit countries and will require further containment measures. But one thing is clear, given what has happened to the economy and the labor market, this is not going to unravel quickly. This is going to be a long, slow, and painful recovery. And given the shock that has hit the world, this is going to be many, many years for the world to get back on its feet. Now, that means that the policies we're talking about, the stimulus to the economy and to support employment, and the transfers to enterprises and workers, and protecting workers in the workplace, and the role of social dialogue, this is going to remain critical for many years. And I think, as also previous speakers stressed, we need to also look at getting the capacities, the institutions in place to ensure that resilience emerges. And we need the right employment policies, the right social protection systems. We need capacity within the system to deliver on that. So, it's going to be a long haul. We're in this together. Of course, the ILO is doing everything it can at the global, but also the national level to support that. But this is going to require a lot of our combined efforts over many years.
Okay, thank you. I think now we should open the floor for questions. Aika, I will turn over the mic to you.
Okay, so hello guys. Before I ask some questions, and I think some of you might have, I'll just read this comment from Hideki. He's from the ILO. So he said, the number of displaced workers referred by Dole from the approximated 80,000 establishment reports, that's approximately 2 million workers, is substantially smaller. It's about less than 1/10 of the number estimated by Ateneo, that's around 23 million. It appears to me that the Ateneo estimate could be much closer to the reality than the reported figure of Dole to date, particularly considering that the ECQ has shut down all businesses except for those in the designated essential sectors. So yeah, so far the Department of Labor and Employment has estimated some 2 million Filipino workers who have been displaced or been in a no work, no pay scheme. So Hideki also said that until the labor force survey of March to April is made available, we cannot be sure of the magnitude of the enhanced community quarantine. So because of that, I have this question. Is there an effort in terms of a pandemic consensus among the organized labor and businesses as well as government to act in the next 12 months or so? Maybe this could be answered by Attorney Sonny Matula.
Hi, thank you, Aika. So actually, because of the social distancing, it seems, of the government with respect to tripartism, the employees group and workers group have come up to some sort of bilateral relations. Last month, we have a labor forum where the Employees Confederation of the Philippines, the Philippine Chamber of Commerce and Industries, and the PhilExport on the part of the employers, and the Trade Union Congress of the Philippines, the Centro, and the Federation of Free Workers on the part of the trade unions. We had a meeting together and we come up with a proposal to at least answer some of the immediate needs of the workers. And our proposal, in our proposal, we call that the joint statement of the employers group and the workers group. We have a common agreement that we need to augment the COVID-19 adjustment measures program. That is to at least maintain the income of the workers who were displaced from work, you know. And our proposal is some sort of a guaranteed income of 10,000 pesos or approximating at least the minimum wage to maintain the wages of the workers covering the period of the ECQ. And that is some sort of a social dialogue which we urge government to at least during this crisis to be more nearer to the workers by communicating with us. It appears that also because of this pandemic, the government is observing social distancing from the partners, from the labor partners. And in fact, we could not present our proposal to them because of this social distancing. The Nagkaisa Labor Coalition, in fact, we have prepared about 1 to 8 items for the government. Like one is the presentation of a clear national action plan, not only for defeating the virus, but also in protecting the people from the impact of the recession occasioned by this pandemic. We understand that this pandemic is worse than the 2009 and the 1998 economic crisis. And so we need really to have a national action plan for this. And in the international tripartite industry peace council meeting the last time, 2 weeks ago, we were not able to see any national action plan. And in fact, the Department of Labor and Employment, hindi nila mapakita kung ano yung National Action Plan, at hinikayat namin na bigyan kami ng pagkakataon na makita ito sa itong mga darating na araw. Yung pangalawa naming proposal ay to provide universal support like the income guarantee, equivalent to at least the minimum wage or 10,000 pesos, whichever is higher, to avoid the bureaucratic bottlenecks created by the targeted support that the government had done earlier. And our number 3 proposal is to prioritize the rebuilding of the national health care and to make it properly responsive to this present pandemic and others probably in the future that are becoming the new normal, together with disaster preparedness and rebuilding. And our number 4 proposal is to improve the protection of all our health workers who are disproportionately victimized by the virus, and to start building up the public healthcare delivery. And Ani had already presented that our health workers should be hired as a regular employee of the civil service and not contract of service or volunteers, you know. And our number 5 proposal is for the Department of Labor to issue an order that would mandate the employer to negotiate with unions or workers representative on practical and realistic COVID-19 protocols at the workplace, including PCRs, based testing of all their workers and employees. And in this regard, we appreciate the DTI statement to the effect that employers are in fact ready to cooperate with government in this respect. And in addition, all employers must provide appropriate personal protection equipment for all their workers, then regular clean and disinfect their workplaces, and provide paid quarantine leaves when needed. And our number 6 proposal is to ensure free medical services should workers be infected. And number 7, the Social Security System and the Employees Compensation Commission must provide simplified guidelines on the availment of sickness and medical benefits in the light of the COVID-19 pandemic. And this agency must provide clear advisory on the availment of the social security benefits and this employees compensation program. And our number 8 proposal is for government to subsidize or give tax incentives to private employers who grant hazard pay of 500 pesos a day, or 25% of the worker's salary, whichever is higher, to their employees who are now actively reporting to work while we are in this economic ECQ, enhanced community quarantine. So the call of the Nagkaisa Labor Coalition is as what Chair Bedrick said earlier also, the social dialogue was one of the pillar. And so the Nagkaisa reiterates that government to consult with trade unions and other people's organizations to listen to and work with the trade unions and the people's organization in addressing the challenges of this pandemic.
Okay, so I guess just to follow up, how do you see this, there's this new normal and then the social distancing policies of the government in terms of when The ECQ, at least in Metro Manila, will be downgraded to the general community quarantine, which will happen in other places starting May 1. How do you see this kind of setup happening? For how long do you see these changes in place?
Mahihirapan talaga yung mga manggagawa na bumalik agad, ano? May mga manggagawa talaga na hindi makabalik sa trabaho. So halimbawa kasi mag-o-observe the employers will observe the social distancing. So you cannot have all the workers observing the previous arrangement, di ba? So may mga kalahati na lang siguro, one-third na lang. So we call on those workers who will not be reporting to work that government should continue to subsidize these workers. And of course, we welcome the proposal of Congresswoman Kimpo of Marikina to support and stimulate or give a subsidy to our medium, small, and micro enterprises to survive in the next 6 to 1 year probably. Alam natin na almost 95% of our workforce are nandito sa medium, small, and micro enterprises. And so we are supporting her proposal to be enacted into law so that the stimulus package can now be started.
Okay, so let's go to the public sector. Maybe Ms. Annie could answer this. Is there any aid provided to those who were government contractuals or on job order arrangements with the government? Because I haven't heard anything from at least the government side in terms of any aid, unless, of course, if they qualify for the social amelioration program.
Okay. So as I mentioned, according to the circular and the joint circular of the Department of Budget and Management and also the Civil Service Commission and the COA, which also covered the job order and contract of service, they are supposed to receive their pay during the quarantine, this enhanced quarantine, and also they are entitled to hazard pay if they are asked to report for work. But that's something that we wish to verify. That's why we are also launching a survey, because we don't know the extent of the implementation, whether they are actually receiving and how many of these contractual workers are actually receiving those assistance. It's only very lately that they have included the barangay health workers and TANOD to receive the social amelioration program. So, for the next few days, we are already started receiving feedback from our contractual, starting with the unions who have members who are contractual, to give us the feedback whether they actually receive or how much they receive in terms of those hazard pay, or whether they are provided with free board and lodging and transportation when they come through and from their work.
Okay, thank you, Ms. Annie. We have a question from Ms. Minette. Maybe Sher can answer this. How long is the predicted time frame before employment can revert to normal levels, the normal that we know of pre-coronavirus?
Yeah, thanks. Thanks for that question. It's a question that I think we all would like to answer because it's so important for the world. But I think it's premature to pretend that we have a good answer on this one. We're still in the middle of the crisis, right? The pandemic is not over. It still continues, and some countries are struggling a lot more than others. As I discussed and mentioned earlier, even the secondary effects continue to vibrate around the world in terms of the trade shocks, the capital flows, disruption, etc. So, it's going to be a long haul, and I think the main thing is to focus on getting the policies right, and the measures and adapting the measures as we move into the recovery phase, which is going to be prolonged. So there's no way that we can give any precise timing on this, but we really have to focus on those policy measures. And I think it's also critical, as also the speakers have also mentioned before, is get as much data as you can. We are living in a very challenging situation in terms of not just terms of the crisis, but data to tell us what's going on. So as Annie mentioned, do surveys. As my colleague Hideki posted, we need to make sure that the informal sector is accurately covered. So we need to look at different data sources, combinations of data, both quantitative and qualitative. And so we need to continue to monitor carefully over the coming weeks, months, and years to see where the progress is being made and where the gaps continue to be, and which groups are missing out, which groups need more support, etc.
Okay, thank you, Sher. Just a follow-up question from the comment section also. Are there any lessons where the Philippines can draw on from the effects of the epidemics, like in the recent past, SARS, MERS had on the labor sector?
Yeah, so that's something we had also looked at the ILO. SARS and MERS were serious health crises, but they were much more contained. There were, of course, strong responses in those cases in terms of school closures, etc. In your part of the world, but they were much more contained, confined, and a short duration. So there's a bit of evidence in terms of some small impact of those previous epidemics on employment and labor, but they were rather minor. The evidence that exists suggests that those impacts were rather minor. I mean, this crisis, to use another much highly a word that's being mentioned a lot in recent weeks, this crisis is unprecedented in that respect. It's a combination of an economic crisis with a health pandemic that is hitting us immediately and continues to hit us, with great force. So it's good to look at previous crises, and indeed we do that as well to look at what we can learn. But these previous epidemics are rather much smaller in terms of the scope and impact on the labor market.
So since it's really hard to see the bottom of this, have you seen any best practices employed by other countries right now in terms of handling the labor and job losses problem?
Right. Yeah. So obviously in terms of the health crisis, countries that have turned to those containment measures early seem to have got the spread of the virus under better control. But I'm not a health expert, and the ILO, of course, relies on WHO for its views on these issues. But if you look at the, employment and labor aspects, there are countries who have the right institutions and policies and resources in place that are able to respond faster and in a more positive way for both business and workers. So in Europe, you have, many countries have subsidized schemes that are in place already to protect workers during downturns. Germany is very famous for its Kurzarbeit, as it's called, which is a subsidy that's given to employers to keep workers on reduced working schedules. And the government steps in and subsidizes that reduction so workers are not losing too much of their income. And now that proved to be very successful during the global financial crisis, and that is again proving to be important in this crisis. So, the good practices are having these institutions and policies in place with the adequate resources to be able to respond. It's very difficult to establish that during a crisis. This needs to be done beforehand in the good times to ensure that the country, the policies, and the measures can respond in an effective and immediate way.
Okay. Thank you. So I guess this could be for everyone. You all agree that the pandemic has changed the workplace, especially for areas that are really cramped. So we see this example for in Singapore. The second wave of transmission was because they were not able to focus on the dormitories by migrant workers. So do you see anything that could instigate a second wave of infection perhaps here in the Philippines, somehow similar to Singapore in terms of labor conditions or dormitories and others? Perhaps Attorney Sonny can answer.
Hello, yes. So yun ang sinasabi namin sa nagkaisa labor coalition dapat balik trabahong ligtas. Kaya we need to make sure that when the workers will be returning back to work, they have a safe place and hindi sila magkakahawaan. Kaya we are calling government to conduct a mass testing. Dapat mag-mass testing tayo para at least malaman natin kung ano ba talaga ang impact nito o ano kalawak yung tinamaan ng infection. Pag wala tayong mass testing, parang nangangarap tayo sa dilim. Madilim na nga. Umaharap tayo sa dilim na pagbalik sa trabaho at hindi sigurado yung safety ng mga manggagawa sa loob ng pagawaan. At siyempre, yung paggawa.
Go ahead, Sonny, sorry.
At siyempre, sa pagbalik ng pagawaan, dapat siguruhin din natin na sa loob ng pagawaan ay safe yung mga manggagawa pagpasok nila at na-observe yung mga safety and health protocol. At napaka-importante dyan yung social dialogue ng mga manggagawa at ng employer. At simply, mapapacilitate yan ng Department of Labor and Employment kung mag-i-issue sila ng Department of Order na dapat ang employer at ang mga manggagawa ay magkaroon ng forum at napaka-importante dyan yung Occupational Safety and Health Committee palagay ko na mapag-usapan itong mga issue na ito. So hindi lamang iisa ang magdidesisyon kundi magpa-participate yung mga sektor sa isang natawag natin na social dialogue na napaka-importante sa pagharap ng mga problema.
Attorney Sunny, just before we wrap up, we'd like to say thank you to Cher for joining today's webinar. I think he has to leave soon.
Yes, thank you very much, sir.
Well, thank you very much. It's been a real pleasure and wishing you all the best.
Thank you so much. Bye, Cher. Okay, so just one thing from Hideki also. I think it's critical that he said that of course, there was the World Occupational Safety Day yesterday. It's the OSH. You also have that new law here. So Hideki said that I think the workplace OSH is key to bringing back the majority of businesses temporarily being shut down due to the radical social distancing measures. Particularly, workplace OSH is critical for MSMEs with limited knowledge and capacity to manage the infection risk. Okay, so I'll give the floor to Ms. Melay. Sorry, we cannot take additional questions, but Ms. Melay has to wrap this discussion.
Yeah, okay. But first of all, thank you to our speakers. I think I'm not going to summarize everything, but I think I will just leave you with three things. That first, three things in terms of what we need to discuss further. One is apparently the challenge is really economic recovery, right? Because employment will also be contingent on economic recovery. I think what everyone is saying though is that, you know, in this economic recovery, you don't leave workers behind. Okay? And I think that discourse was present even before the pandemic. Before this pandemic, we were discussing Industry 4.0, and we already knew that most likely when the economies prosper, that could be at the expense of workers. So I think that's the first challenge. When we say protection of employment, I think it has to be contextualized in, in economic growth models, etc. Number two is the idea of, I think when we're talking of workers, we're talking of masses of people. So this is where the issue of, or the proposal of the income guarantee and universal basic income will come in. I think this is important because in the Philippines, dito sa atin, di ba, may diskurso na parang, yan, bibigyan ba yan ng ayuda? Pasawa yan? O tamad yan? O, di ba? Parang, I think the point of universal basic income is to say, there's a bottom line. Okay? It doesn't matter who you are. As long as you're human, there's a floor that you do not fall under. And I think we should really be pushing that. So if we see, for example, na merong isang, ano ba yun, tricycle driver ba yun, na hindi naka-mask, huwag mo siya arestuhin, bigyan mo siya mask. Di ba? Kasi ang bottom line natin, hindi siya magkakasakit. So, merong ganon. It doesn't matter. Meron naman talagang pasaway sa mundo, marami. Pero, I think that's what it means, no? To be the universal basic income. Of course, this would also require social inclusion for migrant workers. And I think this is where we should come in also kasi in destination countries, kailangan ituring nila na manggagawa nila yung ating mga migranteng Pilipino. Siguro third na lang is to really think about the role of workers' movements. Because the usual concept is that mas nakakagulo yung mga kilusan na yan. Pero actually, I think this is really the time now where movements are necessary because the companies, the governments, they won't be able to consult everyone. So if we really want to know how people are and what they're thinking of and what they need, I think the movements will be very, very important in terms of consulting them and aggregating their interest. So yeah, I think I would just like to end with that notion that this is the worst economic, this is the worst global crisis since the World War II. So I hope since it's the worst, when we come off of this, we're also going to be better, you know, in terms of our economies, in terms of our employment, etc. So again, thank you very much, and thank you to Rappler for this opportunity to talk about labor issues. And let me end with saying Happy Labor Day. Mainit na pagbati sa lahat sa araw ng paggawa. Salamat.
So once again, thank you for joining us. This is the MovePH webinar. Happy Labor Day.